Speaking of scary, the Wuhan virus is making a quiet return. Cases are rising again in India.
COVID-19, Liz Bone.
That's COVID-19. Cases are once again rising.
Ministry confirmed a new uptick in COVID-19 cases.
Hey everyone, let's talk about something that's been picking up attention across news outlets and social media. COVID-19 is back in the headlines, this time due to a new variant, NB.1.8.1. According to Singapore's Ministry of Health, over 14,000 new cases were reported last week, a roughly 28% increase from the week before. Several other countries across Asia are also seeing rising hospital admissions. But what's really behind this new variant? How widespread is it? And what do we know about vaccine protection? Over the next 8 minutes, we'll go over what the World Health Organization, CDC, and other health agencies are reporting, without the fear, confusion, or misinformation, just clear facts and useful takeaways. NB.1.8.1 was first identified in late April 2025, not from one country, but from travelers coming from China, France, Japan, the Netherlands, Spain, South Korea, Taiwan, and Thailand. Think of COVID variants like a family tree. NB.1.8.1 is a sublineage of JN1, which itself came from Omicron. According to genomic surveillance data from GISED, this new subvariant has mutations that may help it bypass existing immunity. Within weeks, NB.1.8.1 became the dominant strain in China. A report from BMJ and The Guardian noted a spike in ER visits and inpatient admissions, prompting WHO to classify it as a variant under monitoring on May 27th. Preliminary lab data suggests NB.1.8.1 is better at evading neutralizing antibodies than earlier strains, which helps explain its rapid rise. Singapore, Hong Kong, and Thailand are currently seeing thousands of new weekly cases. Australia's Department of Health recently reported that NB.1.8.1 accounts for up to 40% of COVID cases in some regions. But let's keep this in perspective. We're not in the same place we were in 2020. We've got better tools, more data, and faster response systems in place. So, is NB.1.8.1 already in the US? Let's look at that next. Yes, NB.1.8.1 has already been detected in the US according to the CDC's traveler-based genomic surveillance program. This system randomly tests arriving international travelers at major airports. The first US case was identified in late March 2025. As of early June, the variant has been confirmed in California, Hawaii, New York, Ohio, Rhode Island, Virginia, and Washington, with around 20 total cases. That number is still small. NB.1.8.1 hasn't appeared on the CDC's national tracking dashboard yet, but based on previous variant patterns, experts suggest it's worth monitoring. In Australia, this same variant jumped from almost 0 to 40% of sequenced cases in just 3 months. So while NB.1.8.1 is present in the US, the current data suggests it's in the early stages, and this time we're catching it early. The vaccines currently available in the US were designed to target JN.1, which is genetically very close to NB.1.8.1. So, experts at the FDA and WHO believe there's still some level of protection, especially against severe illness. Think of it like this. If you've got a raincoat for mild storms, it won't block every drop in a hurricane, but it's still much better than nothing. In May 2025, the FDA's Vaccine Advisory Panel met with Pfizer and Moderna to review early data on full boosters. For now, they've kept the current JN1-based shot. The World Health Organization has also stated that the existing vaccine is expected to offer protection against severe disease outcomes from NB.1.8.1. Bottom line, Getting boosted, if you're eligible, can still reduce your risk of serious outcomes, even if the variant has changed slightly. Symptoms of NB.1.8.1 appear very similar to past Omicron variants. These include sore throat, fever, cough, fatigue, nasal congestion. That said, these overlap heavily with flu and cold symptoms, so you can't tell the difference without testing. If you're vaccinated and otherwise healthy, symptoms are likely to stay mild, but CDC data still show increased risks for older adults and those with underlying health conditions like diabetes or respiratory illness. If you feel sick, especially with fever or a new cough, take a rapid test or consult your doctor. It's the only way to know what you're dealing with. Here's what you can do to stay protected without overreacting. Check your booster status, especially if you're 65 plus or immunocompromised. Keep hand hygiene habits. Test when symptomatic. Consider masking in crowded travel settings, especially airports. These steps may sound simple, but multiple studies, including those by Johns Hopkins and CDC, have shown they help limit spread. And remember, this isn't March 2020. Today, we have vaccines, antivirals, and surveillance tools. To recap, NB.1.8.1 is spreading across Asia and has appeared in at least 7 US states. Vaccines still offer protection, especially against hospitalization. Symptoms are mild for most, but don't ignore them. Take smart precautions, stay informed, and don't let fear take over. If this helped you feel more informed without the drama, hit that like button and subscribe for more science-backed health updates. And let me know in the comments, are you planning to get the next booster?